The bolus dosing administration method is a simple, straight bolus technique. This method of administration utilizes a weight-based dose of 10 microliters per kilogram of activated DEFINITY that is slowly injected, followed by a saline flush. The administration of a full weight-based dose of activated DEFINITY was established in clinical trials using fundamental imaging. At that time, ultrasound system technology for contrast imaging was not widely available. With today's advances in instrumentation, weight-based dosing is less commonly used. Smaller incremental dose amounts of 0.1 to 0.2 milliliters for this administration method is better suited for current ultrasound system technology. The maximum total dose of activated DEFINITY should not exceed 20 microliters per kilogram. Following activation with vial mix, bolus dosing can be prepared with using either pin-sync vented vial adapter 13 mm or 18 to 20 gauge unfiltered needles. 2 syringes are used for this technique, one for DEFINITY and a second for a saline flush. A 3-way stopcock is also recommended so that the saline flush can immediately follow the injection of DEFINITY. Bolus dosing with needle method. Supplies needed include a 3 milliliter or tuberculin syringe, 10 milliliter syringe filled with saline, and 18 or 20 gauge unfiltered needles and a stopcock, which is optional. Following activation with vial mix, remove the cap from the DEFINITY vial. Vent vial with a needle by placing the needle tip in the activated DEFINITY vial. When using a needle, it is important to vent the vial. Venting avoids negative pressure in the vial, which allows for easier withdrawal and prevents microbubble disruption. To withdraw activated DEFINITY, take the 3 milliliter or tuberculin syringe and attach an 18 or 20 gauge unfiltered needle. Insert the needle into the vial. Do not inject air into the vial. Invert the DEFINITY vial and ensure the needle tip is positioned approximately in the middle of the suspension. Slowly withdraw 10 microliters per kilogram of activated DEFINITY. Administer 0.1 milliliter to 0.2 milliliter slowly, followed by a 10 milliliter saline flush. Administer subsequent injections as needed.
Let's review the important safety information for DEFINITY. DEFINITY Vial 4 Perflutrin Lipid Microsphere Injectable Suspension. Indications: activated DEFINITY Perflutrin Lipid Microsphere Injectable Suspension is indicated for use in patients with suboptimal echocardiograms to opacify the left ventricular chamber and to improve the delineation of the left ventricular endocardial border. Contraindications: do not administer DEFINITY to patients with known or suspected hypersensitivity to perflutrin lipid microsphere or its components, such as polyethylene glycol, PEG. Important safety information. Warning: serious cardiopulmonary reactions. Serious cardiopulmonary reactions, including fatalities, have occurred uncommonly during or following perflutrin-containing microsphere administration. See Warnings and Precautions 5.1. Most serious reactions occur within 30 minutes of administration. Assess all patients for the presence of any condition that precludes DEFINITY administration. See Contraindications. 4. Always have resuscitation equipment and trained personnel readily available. In post-marketing use, rare but serious cardiopulmonary or hypersensitivity reactions have been reported during or shortly following perflutrin and PEG-containing microsphere administration. See Adverse Reactions. 6. The risk for these reactions may be increased among patients with unstable cardiopulmonary conditions and/or with pre-existing PEG hypersensitivity. See Adverse Reactions 6.2. It is not always possible to reliably establish a causal relationship to drug exposure due to the presence of underlying conditions. Please see full prescribing information, including boxed warning, regarding serious cardiopulmonary reactions. Full prescribing information is available at DefinityImaging.com from a Lantheus sales representative or by contacting Lantheus customer service at 1-800-299-3431.